Hi, everyone. Welcome to part 2 of our Black Maternal Mental Health series with Danielle James. And before I introduce Danielle, I'd just like to let you know that this is part of a collaboration between Women's Mental Health at the Royal and the Ottawa Birth and Wellness Center. And I wanted to let you know that we have some groups that are starting up in fall. We have a perinatal journaling as a wellness tool, which runs for 9 weeks. It's 1 hour on Zoom, and we talk about different things like communication, intentions and gratitudes. And the goal is to make you, help you become a regular journaler and practice journaling as a wellness tool. We also have a Life with a Baby group that's starting up. It's 1 hour for 5 weeks, and we talk about depression, anxiety, coping tools, communication, and relationships. And we also have our ongoing programs, our perinatal wellness groups, which are people are able to check in. And then based on that check-in, we have a conversation afterwards. And all of those groups are offered on Zoom. They're 1 hour long. And if you're interested in registering, you just need to send me your name, your telephone number, and your residential address. And I will register you and send you a Zoom link. And we will put my email at the bottom of this Facebook Live. So we're so happy that Danielle has joined us again today. We are sure we're going to learn a lot. I'm just briefly going to introduce Danielle. Danielle James was a DONA certified birth doula and postpartum doula, childbirth and lactation educator in the Ottawa area from 2012 to 2020. She is trained in postpartum care, lactation education, baby wearing, and pregnancy loss. She is one of the co-founders of National Capital Doulas and was the co-representative of the Ottawa chapter of the Association of Ontario Doulas for 2 years. She has attended close to 100 births and provided postpartum care for families in the Ottawa area for 8 years. Her lived experience, both personally and professionally, include birth in all its many forms, pregnancy loss, surrogacy, cesarean birth, postpartum depression, common breastfeeding issues, addiction, and maternal mental health issues. She is a graduate of both Queen's University and Algonquin College. Welcome, Danielle.
Thanks so much, Nancy. I want to say thanks again to the Ottawa Birth and Wellness Center and to the Royal Ottawa for giving me a chance to share my story again and talk a little bit more about postpartum today. Again, I just want to say that we're talking about families today, all different kinds of families and birthing persons, their partners, and everyone's welcome. And so I just want to say that a lot of what I'll be talking about today, I think is kind of universal in terms of challenges for new parents. And then of course, I want to be talking about my own experiences, both personally and as a doula. And again, I want to share some of my ideas about ways that we can improve care in our communities. So thanks for joining us. And I'm going to dive right in. So many of you will, if you were listening last week, I had talked about my birth experience. Today, I'm going to talk a little bit more about my postpartum experiences. They were very different. And I'm going to talk a little bit about, I really started thinking about why were they so different? These two experiences that I had after my babies were born. And I came up with some ideas when I was reflecting about that. And so we'll talk a little bit about that later. So as some of you will remember, I was sent home with a slightly preterm baby. Breastfeeding was already off to a fairly rocky start. Even before we left the hospital, he was really tiny. My son was 5 pounds, 14 ounces when he was born. And he was just tiny. His mouth was tiny. He was tired and small. And so no one told me that even though he was technically full term, he was born at 37 weeks and 3 or 4 days, weeks gestation. He wasn't really like other babies that are born at like 40 or 41 weeks gestation. We had trouble breastfeeding right from the start. It was painful for me. I wasn't sure it was working. Like I didn't feel confident that it was going well. I remember taking home, and I want to preface this by saying I didn't really learn anything about breastfeeding before he was born. I guess I sort of bought into the whole, oh, it's the most natural thing in the world. And I figured, yeah, okay, well, I'm planning to breastfeed and it's the most natural thing in the world. So I didn't really learn very much about it. My focus was definitely more on the process of birth and how that was going to happen. So yeah, I definitely I did not have the education that I probably should have had. I remember after he was born watching the Jack Newman videos. Jack Newman, he's a doctor that works with lactating women, and he's got a clinic, and he's kind of famous, I guess, here in Canada. And I remember borrowing the video from my midwife and taking it home and getting into bed and doing skin to skin and putting him to the breast to nurse, and it just doing all the tips on the video. It still didn't seem to be working. And it was heartbreaking. It was like, are you watching the video? Like, I'm watching the video. I don't think the baby's watching the video. It was really, really, it was a struggle. Every time I told someone that the nursing wasn't going well, so I did talk to, like I mentioned it to my midwife. I called telehealth at one point. I had spoken to my family doctor. Like I just didn't, I kept saying like, I don't think it's going well. It hurts, like it really hurts. And they would ask me a bunch of questions, usually focused on the baby, like how often are you putting him to the breast? How long is he on the breast? Are you switching sides? They asked me questions like that about his poop and pee diapers. But yeah, my pain wasn't really discussed, and the advice was like, just keep breastfeeding. So my son ended up in the hospital on day 3. We needed medical care. He had jaundice. He was basically turning orange. And the first thing they did when we got to the hospital, the first thing they did was hand me a bottle of formula. And they were like, feed him this. And I felt horrible. That was that was a rough day. We were in Chio and the staff was amazing. But yeah, I felt like the worst mom in the world. And I had been breastfeeding, like I'd been trying to breastfeed, but it hadn't been going well. And so they gave me formula. He sucked it back. My baby sucked it back. He definitely needed it. And so we had to stay overnight, and I was sore, and like, I had just given birth. Like I didn't feel 100%. It was very emotional. Day 3, when you're trying to establish breastfeeding, we often say day 3, it's like, that's when everybody's crying, right? Because your milk's starting to come in, you can feel uncomfortable, baby's getting hungry. And so the sleep deprivation is setting in. I spent day 3 in the hospital, and my husband wasn't allowed to stay with us. The room was empty, and I know that they have rules about that, but that was really hard. We were separated from my husband, and he was separated from us. He had to leave, his baby behind and go home at the end of the day. And I think that was really challenging for us. When we were checking out, when we were being discharged, I spoke with the doctor, and they told me that they started to explain to me that giving formula wasn't child abuse. And I was shocked by that. Like, I didn't think formula was child abuse. I had, was choosing to breastfeed my baby. I didn't think it was going well, but no one had told me like, yeah, you're right, it's not going well. You might need some more support there. And so that was frustrating. I felt really, again, it sort of reinforced this polarization, I felt of about the feeding. And I felt like the breastfeeding advice that I was being given was kind of really one-sided. And, maybe that's part of the reason why we ended up in the hospital, so that was a challenging experience to have, like, a few days after giving birth. And he was so tiny. And it's definitely, it's scary when you have like a sick baby or just a baby who's sort of not doing well. It's like, your baby's going to be okay. But like in that moment, as a new parent, it's pretty, it's really heart-wrenching, and I definitely felt like I should have been better informed. And again, that's like on me to have like done more reading, but also maybe in some of the advice that I was given. I think that, we can do a little bit better there. I think professionally speaking, and sort of this is coming out of more my experience as a doula, I do wish that the issue of infant feeding was sort of more inclusive, more of a conversation between parents and care providers. The truth is not everyone can or wants to breastfeed. And when we limit the conversation to breast is best, we make a lot of parents feel like they're second best if they aren't breastfeeding. Like I feel like polarized views, like really strongly polarized views like that are not really helpful to parents who are trying to make informed choices that are best for their family and their situation. Parents need information about feeding their babies, and then their choices, I think, need to be respected, especially in cases where a person can breastfeed but chooses not to. There's a lot of shaming that some women experience around feeding, and it can be really damaging. And I'm just going to give like a brief anecdote from my own experience. I was nursing, I was breastfeeding, but I remember going out with a group of people, acquaintances and friends, but I wasn't comfortable breastfeeding in front of this mixed group. And so we were going to be going to a restaurant. And so I decided to I brought a bottle. I had pumped and I brought a bottle to feed my son while we were at the restaurant if he needed to be fed. And, that was always kind of an interesting experience to be sort of a bottle feeder now in this situation, and to see people's reactions to that. And so, like, I think we need to be really careful about that. As a doula, some of my clients, I would say, were not really happy with the support that they received, or the support they feel like they didn't receive around feeding choices that they made. Sometimes I think they felt that they weren't supported enough, but I think other times they felt like the expectation that they would breastfeed, or that was so overwhelming, it detracted from their ability to enjoy their babies. And again, I think that we need to really consider that when we're supporting parents in their feeding choices and helping them with their feeding goals, is making sure that the process is part of a whole and not detracting from, the bonding and the imprinting and those feelings of calm and relaxation and nurturing that we want to see. There's this piece that we ignore sometimes, I think, about breastfeeding and the impact it can have on a person's mental health. And I remember having some interesting conversations with a friend of mine who was a psychologist, and we were on maternity leave at the same time. And we, talking about that, like, wow, like, are there studies about that? Like, what are the studies saying about yes, we know that breastfeeding has all these positive benefits. But has anybody really looked at the mental health piece of it? We're in this weird place where breastfeeding, we know research has shown it does improve mental health. It can improve mental health if it's going well, I think. If it isn't going well, it can negatively have an impact on parents' mental health. We know with women that women with depression or mood imbalances are also more likely to have issues breastfeeding. We know that some people who are on medications for any number of medical conditions, some of these medications, you can't take them if you're going to breastfeed. And so you can see there's like a complicated dynamic to this relationship, and I think it's important to approach each person, with sensitivity and openness to what they're hoping to accomplish, with their feeding goals. It's impossible to compartmentalize these issues around breastfeeding. We have to start treating people as a whole. I encourage people to set their feeding goals, whatever your feeding goals are: chest feeding, breastfeeding. Be gentle with yourself. You need to be gentle with yourself. You need to learn, if you can, learn as much as you can about feeding before your baby comes, and just be aware of how it all works, how your baby's feeding relationship is going to work with you. My son and I did eventually end up working out our breastfeeding issues, as he grew, as I learned. It was rougher the first few weeks for sure. But it started to improve, each day kind of, we hit a little hump. And then I would say that, after that, it started to improve. I think he just got to a certain, size, a certain strength. He was, he's starting to gain weight. He was awake more and he was a bit more vigorous. So I think it's important for people to understand that breastfeeding is a learned skill. It's a learned skill. It takes time to learn. And, it takes time to get to know your baby and to work on that bond. This idea that it's like an instant thing, I think, is a bit misleading. And, lactation educators are working to change that, right? It was part of why I took the training that I took. It's like being able to better support people prenatally, and helping people to understand that it takes 4 to 6 weeks to establish breastfeeding. So, make sure. I wish someone had just been like, Danielle, it just takes a little bit of time, give yourself some time to learn and practice and get better at it. So, like I said, I had 2 pretty different postpartum experiences. The first time around, it was lonely. My husband wasn't home very much. He was starting, I think, like a lot of young couples, he was starting his career, and so he was working long hours. I was home a lot. It's Canada. I had a baby late in the year, so it was winter time. You spend a lot of time alone, I think. At least in my situation, I did. Getting out of the house with a new baby in the dead of winter, it's kind of nerve-wracking, I think. And I think too, it was hard for my husband because, again, he was at a place in his career where he needed, he was having to be at work, and he wasn't able to be at home, but that was very stressful for me. It was hard on both of us for sure that first time around. And I had also been offered a visit by the public health nurse, but I hadn't heard great things about the public health nurse, but it had been kind of mixed. It was a mixed bag. And I didn't feel like, I didn't think I'd need the visit. It's like, I don't need the visit. That's for people who are really struggling, or, for new Canadians, or, it's like, I'm okay. I declined to have her come to the house. I believed what I had been told, which is that having a baby is hard. And I believed it, and when I look back, I can see, with reflection and distance, I can see how I was probably exhibiting mild to moderate postpartum depression kind of early on. I had a challenging birth, an unexpected birth, in the sense that, I had to be induced. We ended up in the hospital on day 3. My husband worked from home for about 2 weeks, but then he had to go back to work and he worked long hours, so I was alone. I was left alone. I was alone with the baby a lot. I want to be clear, like I wasn't diagnosed. This is sort of, like I say, I feel like I probably should have been, maybe should have talked to somebody at the time. I wasn't diagnosed, and I felt like I shouldn't be depressed, right? I was a healthy baby and a healthy mom situation, right? And so, you feel like, well, what, like nothing's wrong. We're both healthy. I have a supportive network, a supportive partner. I have enough money, a roof over my head. I felt like I shouldn't or couldn't maybe, access additional support for my mental health. I think the other thing I learned again later on, and again, definitely seeing it with my clients, so many of the symptoms of PPD look like sleep deprivation. It can be really hard to know. Like it can be very difficult to know the difference. Like a lot of those symptoms will look similar to postpartum depression. Irritability, trouble sleeping, fatigue, lethargy, the mood swings. A lot of these things can also be a result of sleep deprivation. So, as a new mom, like you don't know, you don't necessarily know where you stand. You're not sure where you're really at. And like I say, it's like looking around, I was at my life. I was like, well, like nothing's wrong. So, like I should be okay. I didn't feel like I could seek help. Nobody offered it to me. I probably didn't present. I'm one of these people who present, who's always like, how are things going? Oh, fine. Everything's great. Everything's good. I probably did not describe my situation when I did talk to people and talk to, my midwife or my family doctor. I probably didn't describe my situation in strong enough language, maybe. I think this is where language and culture and context are really important. Discussing pain, mental states, emotions, like these things are rooted in our culture, in our languages, like in our experience. And again, it's like having someone like culturally relevant to be able to talk to and describe what you're going through. I think it's definitely helpful. I lived in Korea for a couple of years. So as someone who lived in a foreign country and had to navigate its medical system, I know firsthand how challenging that can be. And believe me, nuance is everything. Context is everything. Like sometimes it comes down to that, and it's a very fine line. And so I think being able to access relevant care, in that's culturally relevant and, in the language of your choice, I think is really important when we're talking about, these sort of mood disorders, postpartum. I think we could also, do better to give more information in the prenatal period. Again, just letting people know about, postpartum depression, other mood disorders, mental health issues. I mean, I think this is really great right now. COVID has definitely opened up this conversation. Like, I feel like, we're all talking about mental health nowadays, right? And so I think that that's a positive thing that's come out of this. Normalizing conversations about mental health before mental health becomes an issue is so important to, improving the mental health situation in this country. I think we need to talk about things like this. So again, like in terms of, pregnancy and birth and families, talking about these things before baby arrives is really key, and normalizing it before baby arrives. it's a huge transition, becoming a family, having a baby, becoming a family, adopting a child. It's a big transition for people. And often the main emphasis is sort of focused on like healthy baby at the expense of a parent's sanity sometimes, and we need to kind of, again, I think look at it more holistically. I think this is really important too for single parents. So single parents who are choosing single parenthood, they can really benefit by setting up supports and beforehand, like getting ready beforehand. A lot of the time when we talk about mood stuff after baby's born or support after baby's born, we're referring to a partner or a family person, someone who's going to be living in the home like that. But there are a lot of parents who are single parents today and choosing to be single parents today, and they can benefit from still having all the support that they need, because it is available in the community. Now, of course, there is a price tag. There is a price tag with that. And so again, this is why I come back to my thing of access to doula support. But making sure that they can set up that framework, before baby comes, in terms of just knowing, when help is coming, knowing when they're going to get their breaks. This is really key to having a positive postpartum experience, I think. For a lot of people, the postpartum experience is difficult because of the isolation. I know I felt really isolated the first time around, but not the second time around. Not so much the second time around. The second time around, I had a really positive postpartum experience. And I started thinking about why was that? Because the first time around, I had the challenges with, my son coming early, and, my husband worked a lot. I was alone a lot. I had challenges breastfeeding. It wasn't like the second time around with my daughter was, trouble-free. We were moving. I had to pack. Again, my husband was away a lot. He was involved in something with work that required him to be away a lot. And so there were a lot of things. Again, I was alone a lot, and now I had two. But I think looking back at the two experiences that I had, when I was the first time around, I very much had kind of tunnel vision, like, oh my gosh, this is never going to end. I'm never going to have a hot meal again. I'm never going to have an uninterrupted shower. I know this sounds so, but it was like I was trapped in this cycle of just like, feeling that my whole life had been upended, and that all of my needs were now subjugated, and to this baby. And it was really lonely. I had one friend, like a lifeline, that we were on mat leave together, and it was wonderful. She really, again, that peer support was really vital. And I think that I definitely experienced sort of, like the mood swings and stuff with me. There was a lot of like anger and resentment, which I think initially I didn't recognize as being part of like postpartum depression, or potentially part of, like a mood issue. I was just like, I was angry, and I thought I had a right to be angry. So it was, that was my experience the first time around, that, just being lonely and kind of looking down that dark tunnel. The second time around, after my daughter was born, I think about, what was different about that. And I would say, first of all, it was an easier birth. She was born with, I did not have to be induced. I had my midwife, like I was saying last week, I had my midwives there, and, it went smoothly. It went the way I felt empowered. And again, that it had gone well. I had more family support the second time around. I definitely had more mom friends. I would say that my mom network had grown from the first mat leave. And so that was really helpful as well, having that larger support group, for sure. Also, I think because my husband, you know, we both had gotten help at a certain point, had, you know, seen a therapist and that kind of thing. And I think that really helped too. Like he had been able to talk to somebody. He had been able to work through, you know, things that he needed to work through. And I'd been able to work through some things that I needed to work through. And so I think we were both sort of in a better headspace about what being a parent was. And so we were sort of more prepared in that respect. Our mental health was in a good place, I think. And also, again, I had help, you know, when there was a gap in that support that I needed. And I realized at a certain point, okay, you know, I need help at home. And my husband wasn't able to be there at the time that I needed it, you know, bath time, dinner, bedtime, like it was this little crucial time because of the nature of his work. He wouldn't be home. And so I did end up hiring someone to come and help me. It wasn't a doula. She was like a mother's helper. Her name was Sarah. She was amazing. And she would come in and just be that extra set of hands that I needed at the time, a few days a week. It wasn't every day. I had looked at our budget and I was just like, okay, this is what I can afford. And it's like, it made all the difference. You know, for me, it made all the difference knowing that, you know, help was coming like on this regular basis. I knew that she was going to come through the door. And, you know, it's like if things were a little bit out of control in the house or whatever, she was going to help with all of that. And, you know, it helped us get through a hump, you know, at the kids' ages that they were. That was a really challenging time. You know, you have a toddler that wants to be cared for at the end of the day, but you're, you know, sort of like under a nursing infant, and you know, it's like it can get a little crazy, and there's only one of you. And so in those instances, having her help was invaluable. And again, I mean, she's another part of one of the reasons when I was looking at becoming a doula, you know, because the experience of receiving that help really had such a powerful impact on my postpartum experience with my daughter and my son. So it was pretty, it made a big difference, you know, just knowing those few days a week that help was coming. I can imagine that a lot of new Canadians, anyone whose first language isn't English or French, First Nations and Inuit parents who have to travel outside their communities to give birth, LGBTQ2S plus parents, I can imagine that, you know, I can imagine how the isolation might be compounded when you don't see yourself represented in the support systems or the care providers that you're engaging with, you know, or even worse, if you're being met with discrimination or violence. Like it's already a pretty challenging time. You really need that group of supporters who are on your side, you know, and recognizing that, you know, part of becoming a parent is learning how to do this, and that people need, you know, safe spaces where they can come and talk and share, you know, with their peers, and, you know, with care providers who are respectful of what they're building in their families. You know, access to peer support is important, but so is access to real, competent, relevant, professional mental health care. You know, this is why portals like counselingconnect.org are important. There's also Ottawa Black Mental Health Coalition is another, you know, great resource, starting place for people, and, you know, to access support. It's with counselingconnect.org, it's short-term support. So I think it's 1 to 3 visits, but it's a way for people to access free support in a variety of languages, from professionals in their community. And I notice like free support. So this is the thing. I mean, mental health for a lot of us is still not as financially available as it is for some people. And so again, you know, looking at the system and trying to make it as equitable, you know, so that everyone who needs it, you know, like mental health care is just as important as physical health care, you know, and we need to do we need to honor that. And we need to honor that. There's a lot of, I want to talk now a little bit about some self-assessment tools that are often used in postpartum assessment. So a lot of the times as a doula, like we would ask clients, you can use a self-assessment tool to kind of gauge where you're at. A really famous one is the Edinburgh scale. But there's a number of different assessment tools out there that will ask, the person questions about, their mental state and how they've been feeling. And so they'll ask a number of questions, and it's supposed to be used as a tool to kind of help you gauge where you're at in terms of postpartum, mood disorder or depression. It's something that people can use to take as a tool to talk to their doctor or their care provider. And it's something that care providers will use to help people assess themselves. So I just want to point out that, to be cognizant of where and how these tools are developed and who develops these tools. Again, this is that thing about language, context, culture. You want to make sure that the self-assessment tools that we're using are appropriate, culturally appropriate, or like appropriate to the lifestyle of the people who are taking it, who are using it for self-assessment. In order for it to be effective, I think it needs to be culturally relevant. And so again, just to be aware of that, there are a number of these sort of self-tests out there. But I think that's a piece that I noticed, like for myself and within, as a doula, being aware of how culturally relevant these tests are. The other thing about these, the other thing I want to talk about is how postpartum depression can affect partners and or other caregivers. So, 8 to 10% of partners, can experience forms of PPD or mood disorder after a baby joins the family. And so, I was looking a little bit more about risk factors, and we would often talk to our clients, like as doulas, we would talk to our clients about, risk factors for PPD. I think most doulas are, we learn about this as part of our training, and we definitely like to make sure that our clients are aware of the resources and aware of these conditions. So, there are a number of risk factors that are involved, but when looking at partners who experience PPD, some of those risk factors include, among other things, include poverty, hormonal changes, maternal depression, unplanned pregnancy, and I'm going to go out on a limb here and add birth trauma as well. I'm going to add birth trauma in there as well. So, these are risk factors that can affect partners. And, a lot of people are not aware that, mental health can affect the partners after a baby joins the family, not just the birthing person. And so I think, again, making sure that we're addressing mental health as a whole is never a bad thing. We know that having good community support, having good family support, having doula support, can help families, help people in the weeks and months that follow the birth or when a baby joins the family. A lot of people don't realize, again, just the caregiving, the sleep deprivation, and a lot of the hormonal changes and the financial, stress that comes with having a child and caring for a baby. Those factors don't have anything to do necessarily with whether or not you gave birth. As a parent, you're still dealing with those things, whether you gave birth or not. And so again, they can have an impact on your mental health. That is a real thing. Doulas, we're trained to watch for certain signs. We have a little bit of objectivity sometimes, that family members might not have, or that partners might not have. They're tired, they're sleep deprived too. Emotions can run high, around the time when a baby joins a family. So, I think that like, I brought my own experience into, you know, my postpartum work with clients. But also the experiences of all the families I was going to see, you know, because of going and seeing all these different families, you know, at this same time of life, you know, you start to gain a bit of a perspective in terms of like, you know, like what's within like a range of normal, or what's, you know, what's a good baseline, you know, where are most people at, you know, at this point. You start to kind of gain a bit of experience watching families go through these scenarios, and you start to get a sense of how people are doing because you've seen so many other people in similar situations. And I want to point, babies have, you know, they have universal needs. Babies have universal needs, but adults are much more complex. And again, this is what, you know, I think I did not fully appreciate before having kids, and that, you know, through my own experiences, I had a lot more appreciation for it. You know, working in my clients' homes, spending time with them and their babies, other family members, it allowed me to see larger dynamics that were at work in my clients' lives. And I feel like that made me, you know, better able to support them in a more holistic way. It helped me, you know, gauge and be able to say, like, you know, like, let's talk, or, you know, let's, you know, I want to give you, you know, some names and numbers, you know, and see, you know, see if you might find that helpful. You know, I want to be clear. Doulas we're not there to assess, diagnose, prescribe. Like, we're not mental health professionals. We're there to refer to the professionals. You know, we have our scope of practice, and we have our list of references. We have our connections in our communities to be able to refer people to the support, to the kind of support that they need, to the kind of support that they will find helpful, most helpful. Because help is defined by the person receiving it. And this is a very important thing, I think. I learned, and as a postpartum doula, I learned as a mom, you know, receiving help. You know, help is defined by the person receiving it. It's like, what did, you know, you want to be doing what they find helpful, and supporting them, you know, in their own journey. So again, doulas are not mental health professionals. We're just like that little extra layer of, you know, helping hands, you know, just helping to give people a bit of perspective, keeping an eye, and helping families, you know, transition as smoothly as possible. And when we see hiccups, it's like we're able to respond with support. Yeah, like, yeah, I think it's just that little extra layer of support, like at the grassroots, sort of that community level. I think talking to some women, and I say women in this case because you know, my clients that I'm thinking of, they were women. They often, you know, sometimes they didn't feel that they could talk to loved ones sometimes about how they were feeling. You know, they didn't want to sound ungrateful. They didn't want to sound selfish. You know, sometimes it's just, there is still a stigma around mental health. You know, there's this projected image that, you know, new parents, new moms are supposed to be all glowing and happy all the time, right? And, you know, for a lot of people, you know, there's a fear that if we discuss our mental health, if we, you know, if we admit that we're struggling, it's like we'll seem unfit, you know, that our babies will be taken away. You know, there are a lot of people who don't seek help. There are a lot of people who don't seek help. And the sad truth is, some parents die as a result of PPD, you know. Loving and caring parents who take their own lives because of their mental anguish. You know, we can do better in this area of care through earlier education in the prenatal period, culturally relevant support, you know, like culturally relevant support, and better funding for mental health in general. Sorry. So I just want to talk a little bit, again, it's like having had these two very different experiences, postpartum for myself, seeing a lot of other people postpartum. I wanted to think about and talk a little bit about, what we can do to help create positive postpartum experiences for parents. What are some of the things that, I've noticed in my own and the experiences of my clients, what helps contribute to a smoother transition into family life. And, when I started thinking about it, I was like, oh, this is kind of what postpartum doulas specialize in. So, we're as doulas, we're trying to create this environment for our clients. So the first thing is feelings of safety and security. This is so important. This includes being in your own community at home, knowing that you have access to place-based care. So knowing that you have access to, like in your community, you can have access to whatever resources you might need. It can also mean financial security, knowing that your partner can take time off, or that, you are eligible for, maternity leave, that kind of thing. So knowing that you'll be able to have financial security, that your housing is secure, and that you have food security. So these are, when we talk about feelings of safety and security, I mean, this is like at the core of it. Making sure the parents feel like they're in safe environments, for themselves and their babies. Number two, having support in whatever feeding relationship you establish with your baby. So, and right from learning about feeding, through the feeding relationship and eventually through weaning, having support in whatever feeding relationship you establish is so important. It's especially important if the feeding relationship isn't going the way you planned, the way that you wanted it to. Again, these supports are very important. The third thing I'm going to say is short breaks away from baby, if that is what a parent chooses. Knowing that baby is in good, competent care, this allows parents to practice self-care, reflection, and it gives parents like valuable perspective. Remember my tunnel vision, like this is never going to end. I'm never going to have a hot meal again. So, being able to take those short breaks. So again, a family member, trusted family member, partner, loved one, or, postpartum doula, knowing that your baby's being cared for, just in the next room sometimes, and that you can take a nap, like you can rest and relax, knowing that your baby's in good care if you need those breaks. It's okay to take those breaks. And so I think that is a key part of it as well. And then the fourth thing is just better supports for the entire family. So again, just parents, their extended network, everyone benefits from having good mental health supports. And these should, again, be available, in community, locally, in a variety of languages, culturally and lifestyle based, culturally and lifestyle sensitive. We need to make sure that we're reaching all parenting people and not just marketing, these supports to moms and dads, right? We need to make sure that we're reaching, all caregivers and parenting people. I just want to take a second to pause and see if there are any questions. I'm going to be posting some of these main points. They will get posted in the notes. And I will be giving just a quick little one page of references for additional information or websites if people are interested in checking those things out. But I wanted to just take this second and ask if there are any questions, Nancy.
Danielle, there's no current questions. If any comes up, I'll let you know.
Okay, great. Thanks. So I just wanted to kind of talk really quickly here. Towards the end here, I'm getting towards the end. There's a lot of talk, as I was saying, there's a lot of talk about mental health nowadays. Really, it's an exciting time. Like, a lot of things are changing and people are doing a lot of work in this area. And so I just want to encourage people that, if you are struggling, to reach out, to talk to someone. And, there are ways to improve your situation. There is something you can do about the way that you're feeling, and good support is so important. To summarize, I think I would love to see, again, there's a lot of work going on. I'd love to see the work continuing and expanding in the following areas. Of course, I've got my 4 little points. I'd love to see, the first thing, I'd love to see, just better education. And again, it's getting better, but even more, I'd love to see better education about postpartum depression and mood disorders, throughout pregnancy. A lot of people don't realize that you can have depression as, through the pregnancy part, right? And so, making sure that there's better education around that pregnancy and the first 12 months after birth, and that it's, taught in a culturally appropriate way. So again, this is where, better representation, language, and cultural context are really important. The second thing I'd like to see is, or that I'd like to see more of, is more recognition that mood disorders can affect partners, and that all parents, all caregivers can experience, like these mood disorders or depression, regardless of who gave birth. So again, like I said, surrogate parents, or, in some cases, grandparents or other caregivers who are caring for a new baby. I'd love to see paid parental leave for all parents at the federal level to help address inequalities for racialized, LGBTQ, 2S+, and other members of our community who are not always, represented in maternity or paternity leaves. I'd love to see paid parental leave for everyone. And I would point out that there are countries that are doing this now. Iceland, Norway, and Sweden, they all have guaranteed, they all have some form of guaranteed leave for parents. So it's possible. It's a real thing. The fourth thing I'd love to see, of course, is government-funded access to doula care prenatally through the first 12 months after birth for people who want to access it, to help address inequalities in the current system. And one of the things I'm gonna just read real quickly here, when I was doing my little searching and looking at a lot of the information online, I found a fact sheet. It's put out by the National Health Law Program. This is in California. They look at advocating for equality in healthcare in the United States, but they actually have a fact sheet, and the fact sheet is titled, "How Can Doulas Help Address Racial Disparities in Care?" And I'm just going to read a little section of it. So one piece of the solution to help address these racial disparities in care is to expand access to full spectrum doula care. Doulas can provide individually tailored, culturally congruent care and advocacy for pregnant and postpartum people through information, education, and physical, social, and emotional support. While doulas cannot eliminate individual and institutional racism in the medical system, doulas can help improve the maternal health experience and address health disparities by reducing the impacts of racism and racial bias on pregnant and postpartum people of color. Doulas who understand the physical, social, and emotional impacts of racism can provide much needed support to their clients and, above all, help them navigate medical systems of care. All pregnant and postpartum people deserve access to full spectrum doula care. So there's a little fact sheet that's out there. And I encourage people to really think about what full spectrum doula care can do for people in the system. I want to thank the Birth Center and the Royal for inviting me to share my story and ideas with you. I want to say thanks to everyone watching. I appreciate you taking the time to listen. Thanks to all the amazing healthcare professionals out there who are working under difficult conditions right now to provide care for babies and families across Canada and around the world. I want to say to doulas and just people of all colors out there that we all benefit from listening and learning from the experiences of others. And I encourage all of you to expand your awareness and training to include issues relevant to all different kinds of people and their families. Thank you so much for listening.
Thank you so much, Danielle. That was a beautiful presentation, and your presentation last week as well was just fantastic. We can all hope and advocate for full spectrum doula care to be covered by the government. I hope that that comes about sooner rather than later, because I understand what you're saying, and I also believe that that would be a fantastic support for a lot of people.
Thank you, Nancy. Thanks so much for the opportunity to share my story and my thoughts today.
Yeah, thank you everyone for joining us, and keep your eyes out for the next Facebook Live. Thank you.